I'm Dr. Amrut S Kadam. I'm a professor and head of radiation oncology at Victoria Hospital, Bangalore Medical College, Bangalore. Breast cancer is one of the most commonest cancer affecting women across the world and even in India. In India, we see about 1,20,000 cases per year. It affects both genders. It does not mean that breast cancer affects only women. It affects even men also. So there are various symptoms to detect breast cancer. Whenever you feel there is some change or change in the skin structure, or there are some swelling or nodules inside your breast or in your axilla, you need to seek medical help. They will investigate it further and they will check whether you have breast cancer or not. Another important symptom which affects people in a younger age is when there is a discharge from the nipples. There may be redness in the nipple, discharge from the nipple. Discharge may be white in color, or it may be even blood also, blood red in color. Causes of breast cancer include genetic predisposition, wherein your grandmother, your mother or elder sister or other siblings have a history of breast cancer. There's nothing alarming though that if they have got that you will get breast cancer. You just need to be careful and you need to visit a doctor for screening at a much earlier age, maybe 40 years of age. So this is one important thing. Other things being your lifestyle. You need to lead a healthy lifestyle. Use of contraceptives is also one most common risk factor for developing breast cancer. Longer periods or early menopause or your age of menarche being late is also one of the predisposing factor. So one of the important thing which is beneficial is breastfeeding. Breastfeeding is an important factor which prevents breast cancer. So that needs to be followed. So coming to the treatment of breast cancer, we have what is known as multimodal therapy in treatment modalities. So this is one cancer where if proper treatment is given, patient is almost cured, you can say. So initially when the patient is detected with breast cancer, we do what is known as surgery. We have many advances in surgery now. Previously we used to remove the whole breast. Now we are doing much more lesser and lesser surgery, in the sense only the tumor is removed and breast is still conserved also. Following this, patient is given chemotherapy. This goes over a period of 6 cycles, which is almost like 5 to 6 months period. So after this, patient is given radiation also to the affected area, to the chest wall. This will prevent any recurrence of the disease in the future also. If the patient follows all these 3 modalities, it will again depend upon what stage of disease you have and differs from patient to patient. So based on that, if the patient follows all this treatment, there's unlikely that the breast cancer is likely to come back. So this is one important thing. You never need to stop breast cancer treatment in between, thinking that it is not there now, so I don't have to take any further treatment. This is the key in breast cancer, because breast cancer patient survival rates are much better compared to what it was before. There are some temporary side effects seen in treatment. That is, some people say their arms are paining, they feel very fatigued during chemotherapy, hair fall is one important thing. All these are temporary. So once treatment is over, your hair will again grow back to normalcy after a few weeks after you complete your treatment, and even your fatigue also will come back in 4 to 6 weeks. So in radiation, there are no side effects, so you don't have to worry. It's just like an X-ray treatment, and there's nothing that you need to worry about. So it's just an OPD kind of treatment. How do we prevent breast cancer or identify breast cancer in the early stage itself? So one main important thing is women have to do what is known as self-breast examination. They need to check if there is any change in the skin structure. Also, if when they palpate their breast, if they see there are any nodules, it may be either in the breast itself, or it may sometimes be seen directly in the axilla also. This is the key in identifying the disease early. Not that all nodules which are found are cancerous. There might be some benign conditions also which can present like this. So there is nothing to worry. You just need to reach out to an oncologist who will guide you appropriately for further treatment if it turns out to be cancerous.